This is Babaruga Fistula Hospital in northern Nigeria, where a medical event is taking place which could have repercussions for millions of pregnant women throughout the developing world. This medical center, together with 3 others in the country, are spearheading a massive treatment effort to help women affected by obstetric fistula. Fistula is a preventable childbirth injury that results in chronic incontinence for the mother and almost always the death of the baby. It's estimated that it currently affects at least 2 million women in the developing world, who as a result suffer immense physical and psychological damage.
Their dignity has been lost. Their dignity as a woman has been lost because of this problem. They are stigmatized, they are ostracized, they have to leave their husbands, the community rejects them. They are unable to even fend for themselves because they cannot go to the market and other places where they can generate revenues.
Throughout the Fistula Fortnight, hundreds of women, some from neighboring countries, travel to the medical centers to take part in the pilot project. Nigeria has one of the highest rates of fistula in the world, with up to 800,000 women affected. Zainab Abdu is typical of many of the women arriving. 2 years ago, pregnant with her 3rd child, she suffered for 2 days with an obstructed labor, unable to get medical attention. She lost the baby, and a resulting fistula has meant chronic incontinence and exclusion from her community.
After the fistula happened, I would spend all my time crying. I felt that there was no hope. My relatives have now been able to reassure me that this can be fixed, and I have been sent to the Babaruga hospital, and I hope that my fistula can be repaired and that I'll be able to live a normal life.
This 2-week project, thought to be the largest surgical effort of its type, has meant the medical centers involved receiving hundreds of new patients in a short space of time. This has required the preparation of new surgical facilities, refurbishment of hospital wards, and provision of essential post-operative care. A team of 24 Nigerian surgeons and trainee doctors have been joined by 80 nurses and social workers and by 4 international doctors from the United States and Great Britain. Gloria Escbona is a British doctor of Nigerian descent who has a long-term interest in working in this field. Like many of the doctors, she volunteered her services for the project and travelled from London to take part.
It's quite strange being here at the moment. It's sort of a mixture of joy, the fact that I can actually help this woman, and complete sadness, and I could actually say anger as well, that these ladies should actually be in this position in the first place, because just for the want of the simple obstetric care, they've now found themselves in this position. We should also be thinking about how can we prevent this from happening to anybody again in the future. We want to prevent young girls, like the ones you can see behind us, ever having to go through this at all.
This approach of prevention and treatment is at the center of the global campaign to end fistula, led by the United Nations Population Fund. It includes a commitment to increasing availability of maternal health care and to training medical staff in fistula repair. One of the leading experts in this field is the chief consultant surgeon at the center, Dr. Kees Waldeck.
We have to bring the service towards the patients and not ask the patients to come to you. This can only be dealt with by establishing multiple centers, like we did in the north here. We have now established 11 centers where people can be helped, and by training other doctors. I think the training aspects have now become the most important part of my work.
So they have a check-up up to 6 months post-operative.
This campaign and this Fistula Fortnight is actually a step in a long journey to get this issue back on the agenda, or to get this issue on the agenda. The governments and the international agencies are working together towards that goal.
While inevitably many of these goals are long-term, the immediate benefits of providing women with reconstructive surgery can have dramatic and life-restoring results.
Because none of them has lost any hope because of the treatment. They are aware now that the treatment is there. After the treatment, they have hope to go back to their community. They have high hopes because they will become women of dignity again in the community.